After 60 years on the job, the doctor for the Montreal Canadiens, Dr. David Mulder, has retired. He joined the Canadiens way back, the farm team, back in 1963. Can you imagine the things that he's seen? All those Stanley Cup championships, 8 of them, the injuries, all those injuries, some of them, unspeakably awful, all the pain and the glory. Well, in September, Dr. Mulder retired from his role as the team's head physician. The stories he must have to tell. Dr. David Mulder joins us now. Thank you so much for your time today, Dr. Mulder. Congratulations.
Well, thank you.
What an absolutely beautiful career you have and you've had. And I was just thinking about how you've come to feel like part of the family for us watching the games. You know, you're such a constant, such a reassuring presence, always there. I can only imagine how this must feel for you. It's been such a huge part of your life. What does it feel like to retire?
Well, it's sort of mixed feelings. I've enjoyed an incredible opportunity to combine my McGill career in surgery with caring for the Montreal Canadiens and looking after the players that play the sport that I've always loved. And so it's been a very special privilege, and I'll miss it.
Yeah, is it hard to step away, I wonder? I feel like retirement isn't in your makeup.
Well, no, but I think it's time, and we've got a good young crew that are ready to take over, and I think it's good timing.
Is that something you hear a lot from people, from members of the team, but also just the public at large, that you have become to feel like part of the family?
Oh yeah, no, I think, and I sort of feel that way too. It's a very very special time when I'm at the Bell Center. I know everybody from the car park person to the players, all the players, and even to the referees now.
Will you still go to the games, Dr. Mulder?
Oh yes, I can. I go. I have season tickets too. So myself, that our family has always enjoyed. So I'll always go.
You'll
I'll
always
go periodically when I feel like it.
And it must be nice to not have to always go as well, I imagine.
Yeah, that's what I was going to say. That's very nice, and it's and again the team is in good hands, so I feel very confident.
Good. I'm glad to hear that. Do you have, again, I touched on it, all the things that you've seen. 8 Stanley Cup championships, all the incredible injuries that you've treated. What are the moments that stand out to you? Or perhaps I should ask you, do you have a proudest moment, Dr. Mulder?
Well, I guess maybe the caring for Trent McCleary when he got a slap shot and the puck hit him in the larynx and interrupted his breathing. And I think getting him through that, the circumstances involved was a real challenge and very satisfying endpoint.
And when we say life-altering, the care that you gave him, from what I understand, extended well beyond on the ice. He said something to the effect of that you were so much more than a doctor, you were a friend.
Yes, that's true. But I think the key thing about the injury was it's something that I've dealt with in my day-to-day job at looking after people who have been in car accidents or gunshot wounds and suffered similar injuries. So the experience I had there was enormous benefit on that terrible afternoon.
An afternoon that I think of, that I think all Habs fans will remember, of course, was the moment with Max Pacioretty.
Yes.
How, in those moments, and I guess you just touched on it there too, this is what you do day in and day out. So for fans, when we see something like that, we're so unaccustomed to seeing that or watching someone deal with that in live time. So I guess you just bring what you do outside of the Bell Center to the Bell Center.
Exactly. Well, and trauma has always been one of my major interests, and we're all drilled in the ABCs of trauma care every day. And so we knew exactly what to do when he was injured, and we did all the things that are sort of second nature to us every day.
In that moment, you must have had moments in your career where you actually feared for people's lives.
Oh, no question. I guess the biggest fear I had was Trent McCleary. I think that's the closest I've ever come to a fatal injury.
And I think you wrote a book. Was it for your 50th anniversary in the job that you wrote a book?
Yes, yes.
Do you feel like there's another book in you, or did that tell all the stories? Have all the stories been told?
Well, I think most of them have been told, and it was really a fun effort to put them all together and relive some of the stories, particularly the old timers. It was a very special looking after people like Jean Beliveau and Dickie Moore and players like that I really became very close to.
And so do you think there's another book in you, or you've told the stories you need to tell?
I think I've told most of them, yeah.
What are you going to do with all your free time now?
Oh, I've got lots of things to do. I've got lots of other interests, and I've got a farm out in Saskatchewan to look after, and so I've got lots to do.
So you're going to keep busy.
Oh, yeah, I'll keep busy, for sure. I still enjoy teaching our students and residents and go in most days. That's something I enjoy.
So it's just in you to do this. And the idea, like I said, I felt like retirement just wasn't in your DNA. What would you say outside of this job, what has been the most important thing for you in terms of your work, in terms of your life's work?
Well, my life's work has been in trauma. And I think the most important thing was that we were able to convince the Quebec health minister that we had to change the way that trauma care was delivered in Quebec. And when we looked at the record in Quebec for a similar injury in the United States, the mortality in Quebec was 50%, and the mortality in the United States was less than 10%. So Marc Van Cote, the then health minister, and we met him in Quebec City, and he agreed to change to very much a U.S. system where patients went to a hospital that was equipped to deal with trauma rather than going to the nearest hospital. And I think that saved many lives and saved the Quebec government a lot of money. And so I think perhaps that's the thing I'm most proud of.
And rightly so. You spoke about how you feel like this team is in good shape. You're leaving everyone in good hands. How do you feel about the Quebec healthcare system?
Well, I think it's got a lot of good points, and it's got a lot of points where we can do better. For instance, you know that Quebec is the only province in North America that doesn't have a helicopter system for air evacuation, which is critical in trauma, stroke care, obstetrics, and pediatrics. And actually, I'm embarrassed about that. And that's probably because it relates so much to having the best trauma care that is available for every citizen in Quebec.
Well, Dr. Mulder, I'm thinking if this government would listen to anyone, perhaps it would listen to you. So maybe in your free time, you could call up Christian Dubé, the health minister, or François Legault, the premier, and give them a little bit of advice.
Well, we're certainly working on it, and I think they're developing a level of interest.
Good, I hope so. I'm going to finish just by reading you a text that came in here that says, as a young registered nurse, I worked in the OR at the Montreal General Hospital. I assisted Dr. Mulder and was so impressed and awed being in his presence. For such a renowned and highly respected man, he was humble and patient, a true gentleman. I loved him, this texter says. I hope he has a healthy and special retirement. God bless him. Thank you, dear Dr. Mulder.
Oh, that's very nice. Very Very nice.
That's a listener that wrote that in. Thank you so much for all that you've done for this team, for this city, and for Montreal. Enjoy your retirement.
Well, thank you very much for the talk.
Very nice to speak with you. That is Dr. David Mulder, the Montreal Canadiens doctor since 1963.